Hi, this is Dr. Cedeno from Houston Dermatology and Plastic Surgery. Today I'd like to talk to you about acne. So acne is part of the normal skin during ages 8 and 50. We see it in both genders, but tends to be a more recalcitrant problem in women because of the hormonal component. So there are three main components for acne. Number one is the genetic component, number two is the hormonal component, and number three is the environmental factor, okay? Things that we eat, things that we apply, and emotional stress can also play a role. So acne starts developing because of increased production of oil. So oil glands, which are part of what we call the pilosebaceous unit, they're attached to the hair follicle, start making oil, and that oil is that what starts making clogs in the pores. And once the oil clogs, then keratin, which is supposed to be on the surface of the skin, keeps also accumulating, creating what's called a comedone. So a comedone is the most basic form of acne, which are those tiny little pebbles or tiny little papules under the skin. So there are two types, those that are closed, and when they open to the surface and that keratin becomes oxidized, they become the blackheads or open comedones. So that's the most basic type of acne lesion. Then when these comedones get colonized by certain bacteria like P. acnes, inflammatory acne becomes more prominent. Inflammatory acne is composed of two papules and pustules, and when it becomes a more severe form, then nodules and cystic lesions are the hallmark of this more severe type of acne. There are multiple different ways in which you at home can treat acne, and also things that we can prescribe and even do here in the office for you. So we're going to make a series of videos in which we're going to talk about each specific way to tackle your acne.